for joining. We are going to get started in about 2-3 minutes. This is going to give everybody enough time to get joined and get ready to go. So we will get started around 11:02. Good morning, everyone, and thank you so much for joining us. My name is Samantha, and I work with ACOs. I'm the Director of Member and Partner Services, and just want to thank you all for joining us today. We are very excited for the opportunity to present to you the next installment of our free webinar Wednesday series. Today, Salient is presenting The Proof in the Pudding, Part 1, the Wellness Visit. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You should see an attendee interface on your computer desktop in the upper right-hand corner. If you listen in via your computer speakers, or if you would prefer to join over the phone, just select telephone in the audio pane, and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenter by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and address them during the question and answer session at the end of today's presentation. With that, I would like to introduce to you Dr. Gray and Amy Kotch from Salient. Amy, are you there?
Yes. Hello. Dr. Gray, take it away. He said he got cut off and is redialing. That's good.
No problem.
All right. Hold on one moment.
Hello.
Hey, Dr. Gray.
Hey, I'm sorry. My phone just cut out, so I'm on my cell phone.
No problem. We totally understand how technology works.
Yes. Okay. So I missed.
All right, take it away, Dr. Gray.
All right. Good morning, everyone. Sorry for the technical delay. I'm up in the mountains of western North Carolina, and we have 4 inches of new, fresh, light powdered snow this morning. But let's talk about the proof in the pudding. The proof is in the pudding. And in fact, this 14th century proverb, the proof of the pudding is in the eating, was not always referring to the sweet treat as we might think of it today. Nonetheless, this ancient proverb is applicable today, and we'd ask the question, what is in your data pudding? And so presenting today is, as you know, is Amy Kotch, the lead business consultant with Salient Healthcare. I'm Dr. Craigan Gray, Chief Medical Officer. Salient Healthcare is a performance management, performance improvement company providing analytical tools designed specifically for ACO success. Our focus today is annual wellness visit, and this annual wellness visit focus today is for maximizing the quality and financial success that can come by the full and complete utilization of that process within the ACO. So let's begin our conversation. And we're going to ask a number of probing questions that will help open up the ACO for our conversation. And I'll have to tell you, Amy, my computer is just frozen up as well, so I'm flying blind, but we can proceed. We are used to this. So the questions are: how many listening ACOs provide to the physicians actual data on the key performance indicators? Now, remember that the KPIs, key performance indicators, are the CS metrics that measure the quality that's successful for the ACO. Another question is, how many listening ACOs this morning calculate actual savings based upon the key performance indicators? In other words, do you know who is helping or hurting the ACO? And the next probing question is, how many listeners use your data performance management tool to conduct case studies to help guide providers to success? And in other words, using your data to influence the outcomes of providers that need help and encouragement. Now, we have a singular goal here. And our goal today is to begin to peel back the data onion to show how administrators and medical directors can drive change using your basic data resource, which is the fundamental CCLF. Nothing fancy beyond that. And the proper use of this simple data resource can lead to significant financial and quality success. Oh yes, earned shared savings help pay for the hard work needed to generate better outcomes and higher patient satisfaction. Now, an example under our microscope today is how the AWV can improve patient and physician satisfaction, support continuous attribution, and improve and increase clinical quality scores. So, the annual wellness visit. The first in our Proof is in the Pudding series, and we're going to ask the question, why the AWV? Well, the answers can be fairly clear to us. Higher reimbursement, anywhere from $130 to $150, depending on what metropolitan district you live in. But also, it contains 1/3 of the GPRO quality measures, which is just as important as financial improvement in the overall management of the ACO. Now, we know that. It also assigns accountability to the provider delivering the care, and therefore supports attribution, which becomes increasingly important. So, beyond the classical history and physical, the AWV can engage patients in shared savings decision-making, can help as an opportunity to create a care plan with the patient or the patient's caregiver. And it's a chance to educate on emergency room utilization, or to emphasize or underline the importance of the transitional visit if and when hospitalization does occur. The AWV is an important key performance indicator that makes sense on its own, and furthermore, the AWV can demonstrate actual positive change, leading to shared savings, as well as making the ACO more attractive to other payers. And that is going to be of increasing importance in the future as the community ACO expands to care for the entire population of the community. Now, why Salient? Why Salient? Salient's vision is to be an active part of the solution to problems facing ACO administrators and physicians every day. Salient's performance improvement tools help clients to gain valuable insight in the root cause of success so it can be repeated, or problems so they can be avoided. We guide the use of data to measure performance continuously, leading the ACO into becoming a high-performing, data-driven, triple aim organization. So, in other words, when you are able to show with data how each physician can improve against their own data, comparing themselves with themselves month over month, quarter over quarter, the pudding will be sweeter. So let's lock in on how the correlation of the AWV fits into the wellness score and to the quality performance metrics. Then we're going to take a look at the AWV and the correlation with the patient retention and attribution, equally important. And finally, how a measure of financial success correlates with the AWV completion rate, and how that fits for the individual practice and how that matches up for the organization. Let's take a look at some real measures. Amy?
Thank you, Dr. Gray. So the first area to prove is, does it truly reimburse providers at a higher rate? We can show our providers exactly what the cost proposition is for them to make room in their busy schedule to accommodate this type of visit. If a physician doesn't have an extender that can focus his or her efforts on the wellness visit, then they need to potentially replace some of their regular visits, their E&M visits, with this wellness visit. And they need to understand that changing the workflow is going to benefit them financially, as well as their patients with better care. It's simply better business and the foundation of population health. Here are some snapshots taken from the Salient Dashboard Miner, or what we call our dashboards, that show the average allowed amount of the wellness visit for this ACO, as you can see on the left side of our screen. That number is then multiplied by the amount of beneficiaries without the wellness visit. We're looking at the ACO on this right side, and you'll see without the wellness visit, there are 3,900. Multiplying these two numbers comes out to about over $500,000 left on the table. Now, this is done on the ACO level, but we're able to break out the ACO into its various TINs or NPIs, depending on your organization and how you'd like to do the calculations. And you could show each provider exactly how much they've missed out on. This is definitely one way to engage physicians, and as an administrator, you know which physicians respond to this type of financial analysis. Furthermore, it does show the providers that yes, indeed, CMS wants you to do this visit because they're incentivizing you to do it. There are, however, other methods for engagement. As for showing providers the comparison of allowed amount reimbursed to providers for the visit, we can take a look into the Salient Interactive Miner to create collections of visit types separated by level of acuity. On the left side of the screen, you'll see the different level types, levels 1 through 5, and you'll see the claim average payment amount. That's the allowed amount reimbursed. On the right side, you'll see the same information, but for the annual wellness visit. You can see the differences in claim average payment amount. So the AWV is showing $134.50, while a level 5 visit, which, how much effort and energy goes into doing a level 5 visit and documentation, that comes out to $124.71. This further proves the importance of this type of visit. It's a quick example of how to use your performance tool to show providers their own data and to further your initiatives. Now that you've gotten their attention with financial matters, the next proposition to propose is the effect on the quality metric performance. In this analysis, we aim to prove the correlation between the rate at which the annual wellness visit is completed versus the score received in GPRO categories that are covered within the wellness visit. We looked at a sample of 5 ACOs over the performance years and documented the percent difference in annual wellness visit completion from the salient solution. We then took the publicly reported GPRO performance for those ACOs and plotted the scores from the 17 different metrics involved in the wellness visit. The assumption is that you will do well on metric compliance when it comes time for GPRO reporting, and in fact, this analysis does prove that with an increase in wellness visit completion comes increased GPRO performance, as indicated by the overwhelming green color you can see on the screen. For anonymity and privacy purposes, we did not post the wellness visit completion rate scores for the ACOs. However, you can see a steady increase in visits that show you that they all had room for improvement, but a steady increase has been a goal of theirs since their start. This type of analysis is at the high-level ACO data, but as you report GPRO metrics and you're able to save compliance on a TIN or NPI level, then you can actually drive accountability down to the individual provider levels. And with the Salient system, this is exactly what you need to do. This, once again, is a view of Salient's data miner, interactive miner, and what we're looking at is the correlation between those beneficiaries that have a wellness visit done against those beneficiaries that have a flu shot, as seen on the left side. You'll see wellness visits on the y-axis, flu shot on the x-axis, and you can see that this is information on a TIN. Each point is a different beneficiary. The left graph shows a red line with a slope close to 1, which means that there is a direct relationship between having the flu shot and having a wellness visit. And to translate that, you basically can say it's a safe assumption that as you increase your wellness visit completion rate, you're sure to increase your flu shot compliance. The same works for the inverse. On the right side of the screen, you'll see on the y-axis beneficiaries without a wellness visit, and on the x-axis beneficiaries with a flu shot. The red line indicated on the right side of the screen is almost flat or a slope close to 0, which clearly from the two examples shows that if you do not have the wellness visit, you're most likely not going to have the flu shot. Now imagine being able to take this type of information to another payer to privately negotiate and tell them that you are able to get high compliance with flu shot because you can do the wellness visit at 70, 80%. That's a lot of confidence to have in your organization, and it's good to be able to show them this type of information. Now we'll take a look at the correlation between doing the wellness visit and the retention proposition. Here we seek to understand the correlation between those two, and we took into consideration a trend of 4 years worth of data on 2 different TINs. The TIN on the left side is an annual wellness visit champion. They are increasing their annual wellness visit completion rate year over year, and you can see their continuous attribution increasing. Over here, you'll see the different years, and over here, you'll see the TIN continuous attribution percentage, meaning those beneficiaries have stuck with this TIN from Q1 through Q4. They have not rejoined or left the ACO. On the right side, you'll see the completion of annual wellness visits. So the tin on the left is increasing their annual wellness visit completion rate year over year, and you can see their continuous attribution hovering in the 90s. This is ideal for a tin to show just how sticky their practice truly is. Patients see this provider and stay with them throughout the year, and a lot can be contributed to the annual wellness visit completion. Sure, there are confounding factors between this correlation, but it definitely helps with setting up the care plan and understanding a patient's history. Mentally, you're telling the patient, I'm your doctor and I'm here to help you. And this helps to garner trust and further supports the physician-patient relationship. Now look at the right side tin. This provider is doing annual wellness visits at a significantly lower rate, and the continuous attribution is dwindling. Both tins have quite a bit of beneficiaries attributed to them, but the one that holds them the best with less churn is the one that has a better chance of attaining shared savings. What is the cost of a new patient? Studies show it could be close to 20 times that of a patient that has been under care consistently with a single provider. Hitting this key performance indicator by means of the annual wellness visit is going to help the ACO's bottom line. Ultimately, we know the annual wellness visit is going to help the ACO. It is going to reimburse providers at a higher level, which proves its importance, especially coming from CMS, but other payers want providers doing this visit as well. Increased provider revenue is always a plus. Show this data to your providers, show them how much they can make from doing this visit and how much is left on the table by not doing it. It is sure to spark some conversation. And if you're a part of a hospital group, ensure all RVUs are aligned appropriately. We also know that a third of the required quality metrics are covered by the annual wellness visit. This is going to calm the nerves of administrators undergoing audits. If you can confidently say 70% or more are completing this wellness visit, then you know exactly where to find the details. As for continuous assignment, we know it's an important part of the organization to grow and keep beneficiaries on a consistent basis so the provider can work with them to manage their chronic conditions and continue their care plan, making modifications when necessary. The patient-physician relationship is so important for patient satisfaction, trust, and reassurance that the provider will always be there for them in time of need. This is why the annual wellness visit is such an important ACO initiative. Let's take a look at some other important KPIs for the ACO. Here's the scorecard we use in our salient dashboards. We're looking at percent difference. We're looking at the change in performance, and this can be completed on a TIN or NPI level. We're not using an average or a benchmark because as an individual provider, it may not make sense to be able to hit or exceed a benchmark number. When you want to set goals for various providers, make sure that they're reasonable, something that they can hit. So by showing them percent difference in their individual performance, they're able to move the mark at a much faster rate that's more reasonable to their own numbers. Here are the different key performance indicators. The first being spend. Obviously, you want to decrease spend. It's a big ACO goal. Next is your risk scores or your HCC scores. You want those to be appropriately coded to match your population as best as possible. Wellness visit completion rate, which we talked about today. Continuous attribution. We then have percent of beneficiaries with in-network primary care visits. Now, this is a really important one. CMS says that at least 70% of the population has one or more chronic conditions. So a primary care physician should be seeing at least 70% of his or her panel each quarter to practice population health and manage those with chronic conditions appropriately. No longer can a provider only see patients when they're sick. Doctors cannot take on risk if they practice this way, and that is why this KPI is so important. It is truly a great measure to see if the providers are changing the way they practice. Next, you'll see different utilization metrics. We have ER per 1,000, IP per 1,000. Those are common metrics for all organizations, as well as the percent change in inpatient readmissions. All key performance indicators are important to move the needle from the provider level all the way to the ACO level to attain shared savings and improve the care of beneficiaries across the board. Dr. Gray, please continue.
Yes. No, there is no question that doctors and administrators alike want to see better care for the people in the ACO. The ACO is a part of the community. So make your data solution work for you. Make it work for you to illustrate and clearly display the CMS prescribed key performance indicators. There's no hiding behind the average in an ACO when you compare yourself with yourself. The incremental improvement of each provider helps to carry the ACO to quality and financial success. That means shared savings and the lifeblood to continue in the future. Oh yes, and by the way, patients do get better care. Now, a successful AWV completion rate is an active demonstration of a high-performing organization. You saw that 70% or greater can lead to the GPRO completion rate, and as a result, successful quality scores that will lead to shared savings. The flu shot demonstration illustrated that, and the money left on the table by not completing ACOs is significant and is measured, as you saw, in hundreds of thousands of dollars. So a successful high-performing ACO is a potential door opener for other payers, particularly Medicare Advantage. And coming up soon is Medicaid ACO. And in fact, we're already working with a Medicaid ACO in the central part of our country. So eventually, all your patients that you see within your community will be part of the ACO. I'm sure that you can see that in the future because, in fact, the ACO is a community-based organization. So the AWV is just one example of a methodology that leads to both financial and quality of success. So stay tuned for Proof in the Pudding Part 2 coming up in April at ACOs, where we will explore additional ways to use your data to engage success. So we're going to conclude our conversation and open up for a few questions as they may be. And I hope it's not snowing where you are.
Okay, does anybody have any questions? If so, use this time to go ahead and type them in or raise your hand. Amy, Dr. Gray, I am not seeing any questions at this moment. I'm assuming you answered them all. If you do have questions moving forward, please feel free to reach out to myself, Dr. Gray, or to Amy, and I know that one of the three of us can definitely get those questions answered for you. Amy, Dr. Gray, did you want to add anything else before we finish up?
Well, this is C. Gray. I just want to thank you for the opportunity to, again, focus on the annual wellness visit. It is it's just one of many elements that can lead to a successful organization serving a community of people.
Awesome. Thank you. Amy, is there anything you wanted to add today?
No, thank you very much for listening.
Thank you both to Dr. Gray and to Amy today for taking the time to present this wonderful information. And thank you to everyone for participating in today's webinar. Once you do exit, you will receive a survey on the presentation. We would appreciate if you would complete that and provide your feedback. We'll also be sending you an email with their contact information. And if you have any follow-up questions, please reach out directly to Dr. Gray or to Amy or myself. You will also be able to receive a link of today's recording. Please feel free to share that link with anyone. And also, I wanted to remind everyone to be on the lookout. We will be announcing our FLACOS Fall Conference here this week, so be prepared. We hope you all have a wonderful day, and thank you again to Salient for this wonderful webinar. Have a great day.
Thank you.
Thank
Bye-bye.
you. Bye.